Ever wonder why a simple cold can sometimes knock you off your feet for days, especially as we age? It might not be just any old virus. In some cases, it could be respiratory syncytial virus or RSV. This tricky little troublemaker has a knack for causing more problems than you might expect, especially for those over 50. Let's dive into what RSV is, why it's particularly pesky for the elderly, and what can be done to prevent and treat it. What is RSV and why should you care? RSV is a common virus that typically shows up during months like the flu. You might think of it as something that affects young children, but it also poses a significant risk to older adults. The symptoms can range from mild cold-like effects to severe respiratory issues. So if you're over 50, paying attention to RSV is crucial. Now let's break down what you should watch out for. Common symptoms of RSV. When RSV strikes, it often starts with symptoms that mimic a common cold: sneezing, runny nose, and a mild cough. But for older adults, the virus can quickly become more serious. It can lead to severe respiratory complications, including bronchitis and pneumonia. Symptoms to watch out for: persistent cough. A cough that lingers and worsens could be a sign of RSV. Wheezing or shortness of breath. This occurs when the virus inflames the airways, making it harder to breathe. Fever. While not always high, fever can accompany RSV and indicate the body is fighting the virus. Fatigue and weakness. Feeling unusually tired or weak can be a warning sign, especially when combined with other symptoms. Chest discomfort. This can be a sign of more severe respiratory issues developing. If you or someone you know is experiencing these symptoms, it's important to seek medical attention promptly, especially if they worsen or persist. Why is RSV more dangerous for the elderly? As we age, our immune systems naturally weaken, making it harder for the body to fight off infections. This makes RSV particularly dangerous for older adults. Additionally, many people over 50 may have underlying health conditions such as heart disease, lung disease, or diabetes, which can complicate RSV infections. Another reason RSV is more concerning for the elderly is that it can lead to complications like pneumonia or exacerbation of chronic conditions. In some cases, RSV can even result in hospitalization. So it's essential to take this virus seriously and be proactive in prevention and treatment. How to treat RSV. The good news is that most cases of RSV can be managed at home with proper care and rest. However, in severe cases, medical intervention might be required. Here's what you can do to treat RSV and ease its symptoms. Rest and hydration. Rest is crucial to help your body fight the virus, and staying hydrated can help loosen mucus and ease discomfort. Pain and fever relief. Over-the-counter pain relievers like acetaminophen or ibuprofen can help reduce fever and alleviate pain. Be sure to follow the recommended dosage and consult a healthcare professional if needed. Humidifiers and warm baths. Adding moisture to the air with a humidifier or taking a warm bath can help soothe irritated airways and ease breathing. Cough suppressants and expectorants. These can help manage coughs, but use them cautiously and consult with a healthcare provider, especially if you have other health conditions. In more severe cases, medical professionals may use oxygen therapy or other respiratory support to help patients breathe. In some instances, antiviral medications might be prescribed, but these are typically reserved for high-risk patients or severe cases. Prevention strategies. Preventing RSV is just as important as treating it. Here are some simple but effective strategies to reduce the risk of contracting RSV. Wash your hands frequently. This is one of the best ways to prevent the spread of viruses. Use soap and water and scrub for at least 20 seconds. Avoid close contact with sick individuals. If someone has RSV or cold-like symptoms, it's best to keep your distance to prevent transmission. Clean and disinfect surfaces. RSV can survive on surfaces for hours, so regularly clean frequently touched items like doorknobs, phones, and remote controls. Get vaccinated. A vaccine for RSV is now available for adults 60 and older. Speak with your healthcare provider to determine if it's right for you. Boost your immune system. Eating a healthy diet, exercising regularly, and getting enough sleep can strengthen your immune system and reduce your risk of infection. RSV can be a serious concern for those over 50, but with the right knowledge and precautions, you can reduce your risk and manage symptoms if you do get sick. Keep an eye out for warning signs, take care of yourself, and don't hesitate to seek medical advice if needed. If you found this information valuable, please give this video a thumbs up, share it, and subscribe to our channel for more insightful content. As always, take care of yourself and thanks for watching.